frequent use of painkillers. I know that is very common in our community, basically. That's why today I thought of discussing it with you members. So people who use painkillers frequently. You go to the drug shop and buy painkillers in order to manage your symptoms. Such symptoms might include severe headache, back pain, joint pain, and even severe menstrual pain. So basically, you should first of all know that pain is basically, it is not a disease. It is not a diagnosis. It is not a condition. Pain is actually ought to be investigated. You are supposed to find the cause. Yes? What is causing this pain? So basically, you will find that some of these things that are occurring, maybe you're having a joint pain or you're having menstrual pain, severe, and then maybe you're having back pain. So basically, you'll find that for menstrual pain, it can even either be hormonal imbalance or basically or estrogen dominance. So if it's joint pain, what does it mean? It can even be that you're having arthritis, inflammation of the joint, or even you can even be having gout. So basically, you are supposed to know the cause of the pain in order for you to treat. You treat the cause, you don't treat the pain directly. For how many days are you going to be swallowing painkillers if basically you just want to reduce the pain? So that is really not the treatment. I don't want to lie you, because some of these doctors, they want to only give you painkillers so that they can get money. But for the mere fact that if you're able to treat the pain, so which means that if you're able to treat what is causing the pain, you know that you're able to treat the pain itself, because the pain is going to reduce if you treat the cause. Yes? So basically today I wanted us to discuss more about the disadvantages of these drugs that you're taking. Basically the non-steroid inflammatory drugs that you take, those painkillers, meloxicam, peroxicam, naproxen, to mention but a few. But you know most of them, you know most of those drugs that you always buy from the drug shop. So these non-inflammatory, non-steroid drugs that you always buy, those painkillers, actually when you take, with time, they're going to cause for you problems. Now you'll find that these drugs, first of all, they affect your gut. Yes? Secondly, they affect your kidney. And thirdly, in women, they always affect their reproductive health. So basically, you should know that these non-steroid drugs that you're taking, they're not that good, those painkillers. So basically, I should explain, yes, how does it affect the gut? So frequent use of these painkillers that you always take, you'll know that it always is going to cause corrosion of the gut wall. So around even the stomach, if it is over corroded, you start peeling off the wall of the stomach. You know that the stomach produces gastric juice. And this gastric juice is having concentrated hydrochloric acid that is almost 2 molar concentrated. So when it starts breaking down the stomach wall, which is protein in nature, it is going to cause wound. That's why most of you start experiencing ulcers. It is because you overuse these painkillers. Yes? You start experiencing, some of you even get gastritis. Some of you get a lot of peptic ulcers. It is because of these non-inflammatory drugs that you're taking, the painkillers. You basically want to reduce the pain, but you don't know the cause of the pain that you're experiencing. Yes? How does it affect the kidney? It reduces blood flow to the kidney. So when the blood flow to the kidney is being reduced, or it is temporarily inhibited, you'll find that the kidney is not accessing nutrients enough, it's not accessing enough oxygen, it's not accessing enough immune cells. So you are increasing chances of infection, for example, the bladder infection, recurrent UTI, and even kidney infection. Basically, this drug that you're taking frequently, it is blocking the pathway through which blood moves to the kidney. So basically, even you're going to increase chances of you getting anemia, because some of these blood components, for example, red blood cells that transport oxygen in form of oxyhemoglobin to the kidney, they are going to be reduced. They cannot easily go to the kidney. So basically, you're increasing chances of anemia, a condition of low blood count. I want you to follow me on the next video that I'm going to create, so that you also know the effect on the reproductive health of women, because this video has become so long and it won't go through. But if you have enjoyed and maybe you have increased your skills on this information that I've given you, you like that button and then you give me in the comment section what I can discuss for you in the next video. Yes. Thank you so much.